Good evening. Welcome everyone to this evening's episode of Matters of the Mind, the Mental Health Awareness Month edition. I am your host, Elisa Abernathy Boston. What is Matters of the Mind? Matters of the Mind is a space where people, professionals and non-professionals, come together and have candid conversations about various topics. The topics range from mental health, careers, finances, and so much more. We dive deeper and give unbiased, real perspectives on whatever that particular subject matter we're talking about for the evening. We are kicking off these conversations talking about mental health during the last week of Mental Health Awareness Month. I am so excited about tonight's conversation, especially because despite the uptick of mental health diagnoses and crises, there are still people on the fence about participating in therapy. Yes, people are still questioning, why do I need to do this? So there are some clear indicators when it's time to make that appointment, and there are subtle ones. So tonight we talk about when you should go to therapy and how can you recognize the subtle signs it's time to take an embark on the journey of therapy. And so tonight I want to welcome my guest, our first guest for this week, Dr. Shantae Bassett, psychologist. We are happy to have you here tonight. Welcome, welcome, welcome. So we need you to answer 3 questions for us. Who are you? What do you do? And what does this mean to you, this particular conversation, and just being in this space tonight?
Got it. Thank you so much for having me, Elisa. I'm so excited about the conversation. I am Dr. Tay Bassett, Dr. Shantae Bassett, whichever one you prefer. I am a licensed clinical psychologist, adjunct professor, associate pastor, entrepreneur, and author. And what does this mean to me? I think that it's important that we talk about mental health related concerns in safe spaces, because sometimes if we just keep therapy in the classroom or in the therapy room, some people will never get the help that they need. So we need to go to the places where the people who don't want to go to therapy really need to hear what we have to say.
I love that. And I want to actually, before we jump into the questions for tonight, I want to ask you what made you or what uh, encouraged you to come into this field? Was there anything particular that encouraged you to give back in such a way?
That's a great question. So I remember from being a little girl, I always wanted to help. Like if people asked me what I wanted to do when I got older, I wanted to help. And when I was younger, I wanted to be an artist. And I think as early as 13, I knew I wanted to be a psychologist, and that might sound really odd, but I knew I wanted to help people. And as I got older, it kind of fine tuned into me becoming a therapist.
Mhm.
So from the age of 13, watching Law and Order SVU and watching the forensic psychiatrist, like that was where it started for me. And I realized that I couldn't base my life's work on on a TV show. So I started to do more research. I took my first psych class at 17, and it's been psychology ever since. So that's at my core, I wanted to help people. And this was the vehicle that not only I wanted to use in order to help people, but I do believe that it's a calling as well.
I think that's so awesome. And hopefully we'll have some younger viewers that'll see that. Like if you're 12, if you're 13, if you're 14, no matter what your dream or goal is, it is obtainable, right? With hard work and dedication. So besides what you've seen on television, right? You are really living this thing. You are doing the actual work. In your opinion, what are some common signs or indicators that someone should first go to therapy and then benefit?
Got it. Well, if you allow me to, I want to backtrack and then come back to answering the question.
Yes.
So I think that one of the common misconceptions in a lot of different communities is that you have to be mentally ill or you have to be in distress in order to go to therapy. And that's not the case. Therapy can actually be preventative.
Yeah.
So I don't know that there are some indicators where, yes, you should get that additional support. But some people go to therapy just to have a safe space to talk. Some people are very private and don't want to share, but they go to therapy because that's a place where they feel they're safe to share. Some people will just go to therapy for self exploration. Like, you know what? I'm all right. I'm not experiencing any distress. I just want to see why I am the way I am and how I can be better. And then you have people who are in distress. And
Yes.
as far as like, well, how do I know when I should go to therapy? When you're not feeling yourself and it's impacting your functioning. That's
Yeah.
when something might be wrong. So we can look at all of these lists of diagnoses and say, oh, well, feelings of sadness or feelings of anxiety. Those are things that we can experience sitting in traffic on the BQE for those of you who are New Yorkers.
Yes.
This is worldwide.
Yes.
But those are normal responses to life's experiences. But when it's in impacting your functioning, making it difficult for you to engage in activities of daily living, like going to the bank or making dinner, things like that, then that's probably an indicator that you need additional support.
Yes. I love everything you said, and I'm going to go back to go forward on the daily functioning. One of the things that I say when I sit with my clients or I sit with them and they talk to me, I say going to therapy isn't what's wrong with you, it's what's right with you. I always remind people that we put more emphasis on physical health, not realizing that if your mind is not intact, if you are not functioning well mentally and emotionally, the rest of you is soon to kind of unravel, right? And so, with that being said, the daily functioning, how that's impacted is, again, like you just said, I've seen people with certain diagnoses who they don't bathe properly. They're not combing their hair, right? Some people may think that signs of certain diagnoses it's really loud. Some of them are really subtle. Like you would think any person every day would want to get up and shower and bathe, but sometimes you can be dealing with something so profound you don't even have the capacity to get up and wash your face or
Right.
brush your teeth, which also can be indicators.
Yeah, absolutely, absolutely.
Yeah.
And one of the things that's so important is that, I said a lot of different cultures, like tending to your mental health, it's taboo. It's not something that you do. But I encourage clients, I remind them that, you know what, going to therapy is actually, it's not a sign of weakness because some people will think, oh, well, if I'm asking for help, then it's a sign of weakness. It's not a sign of weakness, it's actually a sign of strength
Yeah.
because you are insightful enough and knowledgeable enough about yourself to realize one, that something is going on, and two, that you need further support. And it's not a matter of, oh, I'm asking for help. you have the insight to realize that, hey, I need additional support at this time in my life.
Yeah, and that's the truth, right? And so with that being said, us realizing that participating in therapy or counseling isn't about what's wrong with you. It's about, I know that something is happening. I don't know what's happening.
Right.
Where do I go next, right? And so how do you think that therapy can contribute to personal growth and overall well-being, right? Because we're talking about maintaining good mental health. So how
Right.
do you think that therapy can contribute to personal growth and overall well-being?
I think therapy, the first thing that comes to my mind is modeling. And modeling a safe relationship. Some of us don't know what safe relationships look like. Some of us don't know how to respond in certain situations. So I see therapy as an opportunity to navigate those difficult situations or those challenging relationships in a therapeutic space. So, let's say, talking about the LIE, let's say somebody cuts you off and you have this very strong emotional reaction, and like thinking back, like let's say you get home and it's just like, wow, why did I respond in that way? That's
Right.
something that you can work out in therapy without someone, getting out their car and confronting you. You can explore, okay, well, what did that activate for you? Why did you have such a strong reaction? What did it
Yeah.
remind you of? So you can ask those questions that you don't get to ask in you know, these other situations in real time.
Yeah, and that's true. And I think that's important to think about having this space to be able to talk about different daily experiences, different things that you have, your responses that you don't normally have. Being able to be in that safe space to say, hey, I notice every time I get frustrated, I yell. Like I don't know how to talk and communicate what I'm feeling. I just start yelling, or I always get in arguments, or I'm always in a space where I'm defensive, right? So, with that being said, let's talk about the types of therapeutic treatments and modalities. You could give me one or two, right? When you go in, a person that's going to therapy, because these are things, some of the questions that people may have, right?
Right.
Okay, we've gotten past the point of maybe why, what are the signs, but what happens when I get there? What is the therapist actually doing with me when I get there? What can I expect when I go into this space?
That is such a great question. And I encourage everyone to be an educated consumer. So you don't want to just, oh, let me go on psychologytoday.com and find a therapist who's in my zip code. It's important that you have an idea of what to expect, because some people, if they don't know what the process of therapy is going to look like, it's off putting for them because
Yeah.
they didn't know that someone was going to ask them such personal questions. You know what I mean? So it's really helpful to ask questions and know what you're expecting. So you asked about modalities. There's so many different approaches to therapy, and it's helpful to find an approach that works for you. And sometimes finding that approach is going to take going through a couple of therapists. I know it sounds daunting. It's just like, I gotta kind of pour out, bare my heart to this person, and then we don't connect, and then I have to find someone else. And that part of the process can be daunting. But there are different approaches. There's psychodynamic psychotherapy, and I guess you could say that's what the media portrays. So, like sitting on the couch, and the therapist doesn't really say much, and they say, "So, how does that make you feel?" Like, that's
Yeah.
the couch type of therapy, right?
Yeah.
And it's focused more so on your past and how it's impacting you in the present. And then you have cognitive behavior therapy, which is more so present focused, and it's
Yeah.
about your cognitions, your thoughts, and how it affects your behaviors. So let's say someone is having difficulty sleeping, they're experiencing insomnia, not really understanding why. So in CBT, for example, you might come up with a plan to kind of restructure your sleep routine, adjusting your sleep hygiene so that you can improve your sleeping. So very direct, goal oriented. Those are just two examples. There's so many different modalities. I do a lot of work with survivors of trauma. So CPT is something that I use as well. Cognitive process therapy. So again, it's focused on the thinking, but it's a narrative based therapy because you're writing about the traumatic encounter. And as you write about it, you're writing about it in different ways and extracting your core beliefs and the stuck points. So those are just some examples. There are trauma-focused interventions. There are relational interventions, interpersonal interventions. There's so many different approaches. But I think above all of that, the connection that you have with the therapist is
Yeah.
most important because they could therapize you. I know I made up a word. They could, use whatever modality. But if there's no connection, if you don't feel like they relate to you, then what are we really doing? You're not going to be receptive regardless of what the
Yes.
modality is.
And I love that you segue into the connection between the therapist and the participant because I've been having conversations with different people about therapy. And one of the things that's been coming up a lot is people wanting to see and be seen by therapists that can identify somewhat with them, whether it is by most of the time it's by race, right? Because you don't know what your therapist like lived experiences, so you can't say,
Right.
"Oh, I want a therapist that's lived what I lived." But you want somebody that have an idea of that their cultural sensitivity is there, right? Or religion or belief system, right? They want to go into spaces where when they're talking to these individuals, they understand. And so when they're creating the treatment plan, that it's cohesive to that person and that person can connect with the therapist and they feel like, it's a team effort. And I think I want to also stress that. And as I'm talking about connecting with the therapist, we want to segue into the misconceptions and stigmas because that's why a lot of people don't go to therapy because one, they feel like they're not going to find someone they could connect with. Two, they think that they're going to just be given pills and medications. Then they think about, oh, they're going to diagnose me. Now I'm going to be labeled. And now this is going to have a negative impact on my life. And the truth of the matter is none of those things may happen, right? You may not, and you have the right to decline medication, right? And so you can speak to those pieces that I just brought up, but you know, I
Right.
think that it's important for people to understand that when you're going through this process, it is about finding what you feel that you could connect to, and I agree with that.
Right.
And
Well,
so,
I'm sorry.
go ahead. No, go ahead.
So speaking about the medication piece, absolutely. I've heard people say, "Oh, well, they're going to pump me with meds and, I'll be on medication for the rest of my life." Absolutely not. There are some providers who are, pro medication, some are anti medication, and some people like myself. My response is it depends. It depends on your circumstances. There's so much research that shows evidence that the best approach when a person is can benefit from medication, the best approach is to combine medication with therapy.
Yeah.
Medication by itself without the therapeutic relationship is like a band-aid on a
Mm,
gaping wound. It's
yeah.
temporary. Actually, if not on a gaping wound, because a Band-Aid isn't going to help at all, but
Yeah.
Band-Aid is temporary, and that's
Yeah.
what medication is. So when I speak to clients who have that concern, the way I break it down for them is that medication brings you to baseline. So it brings
Mm,
you to a place where your symptoms are manageable so that way you can be receptive and learn what you need to learn during therapy. The
yeah.
example I use is psychotic disorders. So let's say someone is actively hallucinating and hearing voices and they're sitting in therapy with me. Do you think that they're going to hear what I'm saying about the skills that I'm teaching them? Absolutely. I mean, they might hear me,
Yeah.
but are they going to be able to understand and process what I'm saying? It's less likely because they hear these voices in their head at that time. So the medication will help to maybe turn the volume down on the voices or decrease the voices. Okay, so we've turned the volume down. Now I can hear what Dr. Bassett is saying. I can learn the skills. That way I can apply these skills outside of the therapeutic room. You know what I'm saying? Like you wouldn't
Yeah.
be able to receive all of that and learn and process if you had all of these other symptoms going on. So that's not just the case with psychotic disorders. If you suffer from major depressive disorder,
Yeah.
if you can't get out of bed, if you can't shower, then how are you going to get to therapy, whether it's in person or virtual, right? So if the medication can kind of help you with those symptoms so that you can get up and do what you need to do, get to therapy, learn the skills so that you can manage. So that's what I mentioned to people who are concerned about medication. Medication isn't for everyone.
Yeah.
Sometimes you just need someone to listen who's not going to say, well, if I were you, I would. You know what I mean? Sometimes you just need,
Right.
and the talk therapy is sufficient. But for some people, when their symptoms are so distressing that it impacts their functioning, then medication could be helpful. So I think that's a big misconception that people have about therapy. And also, like we were talking about before, oh, I shouldn't be asking for help because asking for help is a sign of weakness. It's actually a sign of strength because you know
Yeah.
that you need additional support. So I think those are probably the main two that come to mind when I have
Yeah.
conversations with
I
people.
agree. Specifically in particular cultures and certain belief systems, they shy away from that. But let me ask you a question. Is it possible, because you're a prescriber, is it possible for a person to get to a point where you would recommend, or are you a prescriber yet? Let me ask
No, no, no. I didn't want to go to med school. I left it over there. But I will let you finish your question
that.
and then I'll answer. Like, no, not
Well,
me.
no, because you probably could speak to it anyway. Do
Mhm.
do you know, or have you had any cases that you have actually worked with that the person was on medication, but they have stabilized to the point of, or at least they were able to wean off, and you can see stabilization? Is that ever a thing?
Absolutely. Absolutely. There are people who became stabilized on antipsychotics and
Mm,
off of the medication, they might, experience some delusions or hear some voices, but it's not impacting their functioning, and they
mm,
are okay with living that way. I've worked with people who have weaned off of antidepressants
mm.
and anti-anxiety medication. It is absolutely a thing. It's possible. So if you take medication one time, it doesn't mean that you're going to stay on medication for the rest of your life. Absolutely not.
I love that you answered that, because I think that's also a misconception, right?
Mhm.
That
Yeah,
you have to get on medications and then you never can get off, right? People think
right.
that once I start this, that's it. That's the only way that I'm going to be fine. No, but if you tie the two together, as you stated, and
Mhm.
marry the treatment with the medication management over time with consistency, there is a possibility of transition.
Absolutely.
Transition.
And I'll share that there are maintenance medications, but there are also what you would call a PRN or as needed medications. And sometimes some of our symptoms will get so severe that we need something to help us. And I'll share a personal experience. I have test anxiety. So I
Mm,
was prescribed a PRN so that I didn't have a complete meltdown during my licensing exam.
wow.
So yes, it was a psych related medication, but it was intended to help me for that moment. Doesn't mean that I have to take, anxiety medication for the rest of my life. It was prescribed rather to help me in that moment. And some people benefit from those type of medications as well.
That is so good to hear, because I think that even myself personally, right? Um, any medication, whether it's high blood pressure, cholesterol, whatever it is, right? We just sometimes believe that once we're on it, that is it. Again, I hope everybody read the disclaimer before you came into the show. We're not recommending anyone to stop or discontinue anything or to
Exactly.
start anything. That's for you to talk to your doctors about. But it's good to know that there are opportunities that you can. It's not a life sentence, right? If done right. But obviously, depending on your therapist and the treatment and all of the things that you work out with that therapist. So, what are the cultural, societal, and family factors that might influence a person's decision to go or not to go to therapy?
Some of you on live might have heard this phrase, what goes on in the house stays in the house. That is the case with a lot of cultures. And some people will think, oh, well, if I go to therapy, I have to tell all my business. And I was told that I shouldn't be sharing. And so many people are suffering in silence. We've heard that phrase before, right?
Yeah.
Because they don't want to tell the family business. They don't want to tell their personal business. There's so many things that they're holding close that they would benefit from sharing. So I think that's one cultural thing, like, oh, you're not supposed to tell your business. And
Yeah.
there's a lack of trust historically when it comes to therapy. Because, and you and I, we are two Black sisters, right? People of
Yeah.
color sometimes have this like this historical mistrust because the very field of psychology was founded by middle-aged white men.
Mm,
So historically, we have distrust when it comes to those racial concerns. So unconsciously, some people don't want to go to therapy because it's like the therapist is going to be white, and they're going to take everything that I tell them and they're going to twist it. And but
right.
that's
And
not
just give me a
always
diagnosis. It just
right.
diagnosed me.
Right, diagnose me, and it's gonna be on my records, and then give me this medication, and that's not the case, and that kind of goes back to what we were talking about with regard to finding a therapist. You can find a therapist who isn't a middle-aged white man, who doesn't represent, historical oppression and things like that and mistrust. So that's something else that is, that kind of gets in the way of help seeking with regard to culture, and not feeling related to. Now, I will say this. Some people think, I'm sorry, I definitely thought I turned these off. But some
Please.
people will think that just because the therapist doesn't look like them, that they can't relate to them.
Yeah.
And that's definitely not the case because I've had therapists who, yes, the therapist has a therapist. Amen. That's
Yes.
helpful. But, I've worked with therapists who were middle aged white men. And
Mm,
I learned some of the most important lessons
mm,
in those spaces. So it's
yeah.
really not a matter of, it's not only a matter of the person looking like you, but do they honor who you are in that space?
Yeah.
And that's so important. Like we sometimes, we can look for someone who looks like us and, it works out. Or you can go into the therapy room and say, it, I don't feel like they heard anything I said, or I don't you really, enjoy the approach that they're taking. So be
Yeah.
open to the process. I would say that that's helpful as well.
And it's so unfortunate that, and I feel like me and you are the I don't want to say leaders of the new school, but we are the advocates. We are the ones. Not only are we in this space to help change and transform lives, right, mentally, emotionally, but we're also here to also pass and further the message of the importance of entering these spaces. And it's unfortunate that even in this day and age, we still have so many people who will debunk or say, "How could you tell me about myself?" or just really disregard the vitality of sitting in a space, a safe space, where you can really go deep and dive deep and really unpack generational generational experiences that are keeping people bound. So a part of therapy is also to help you develop and grow, right, as a person. In
Absolutely.
those spaces, you're kind of unpacking the childhood part of you so that the adult part of you, because some of us that are having some of these behaviors or we're experiencing some of these things is because we have not even addressed the childhood traumas, because like you
Yeah.
said, we were told and we witnessed as children lack of communication, lack of support, lack of openness, not being able to speak because that was made culture in our homes to just not talk, to just deal
Right.
with it, to just bear it, right? And so I'm unsure about therapy. What do you tell me? What do you say to me? I'm unsure. I think it's something that I need to do. I hear about it. I see the 988 number, which that's a little bit more severe, but I'm seeing all of these different numbers. I'm seeing all of this thing pop up everywhere. I'm seeing these things happen on a train. I'm seeing these really severe experiences happening where mental health is really being talked about, and I feel like I need to be there. How do you help me? I need advice, doctor. Give me advice.
Well, I would start out by asking, what do you hope to gain from seeing a therapist? Some people just go like, "Oh yeah, my family said I need a therapist, so, here I am." But what do you think you could benefit? How do you think you could benefit from therapy? And we could navigate that part of the conversation. Okay, well, you have these goals, X, Y, and Z. What do you How do you think you can go about achieving those goals? Do you think that talk therapy would be helpful for you? Are you a talker? Do you feel comfortable speaking, telling people like your personal business? Do you have trust issues? These are things that could get in the way of therapy, but these are also things that could be healed in therapy. So
Yeah.
it's important to kind of consider that and push past the discomfort. I think that's probably the most important thing because therapy, especially for someone who's never been in therapy, it can be daunting. Like, I'm telling you all of my business. I don't know why you're typing and where you're saving these notes and who's going to
Right.
read them. You know, all of these things. It's helpful to just embrace the discomfort, but be honest about what you're feeling. Like,
Yeah.
and find someone you feel relates to you.
I agree. And if I were to answer the question, if you're unsure about it, first I would say it's okay to be unsure about
Mhm.
that experience. It's like with anything in life, you may feel like you want to transition, and I'm using this as an example. You may feel ready to transition out of one space into another space professionally, but you're unsure, right? I think that being unsure is a great place to be because you can ask questions, as Dr. Bassett just said. You can ask some questions. You can create some bullet points. You can say, okay, first I'm assessing my why, and then I want to explore, and this is me kind of reviewing the whole conversation tonight, me exploring what I want to get out of therapy, right? And so then I'm saying, well, what is it that I would like this person that I'm looking for to specialize in. So that's another thing, Dr. Bassett. When a person is looking for a therapist, should they be looking for what the specialties are of that particular therapist? Because I think that's important too. I finally, and this is me being transparent, actually, I've been looking for a therapist for a few years.
Wow.
And when you are in the field, your looking is a little different from a person who's not, because you kind of have an idea of the field, so you're particular. And so I know for me, I finally found a therapist outstanding, excellent, checked off all of the boxes for me. And also I looked under their profile to see what specialties.
Yeah.
So should a person be looking for specialties of that therapist, and how should they be choosing a specialties, because they don't even really know what's wrong. They just know that they want to go to therapy.
Right, right. I think it's helpful for the person who kind of has an idea of what they're looking for. Let's say, okay, I can't sleep. It could be anxiety. Let me look for someone who specializes in anxiety. Or, the doctor said that I might have postpartum depression, so it must have something to do with maternal mental health. Let me find somebody who focuses on that. So in that case, I'd say it's absolutely helpful to find someone who has practices a specialty or has a specialty that is in alignment with what you're looking to work on. For this person who just wants to go to therapy, they're not really sure what they want to work on. They just, they're kind of exploring. I would say find someone who meets some basic criteria for you. So let's say you want a black female therapist who's Christian. A lot of people come to me like, "Oh, you referred to me because you fit these boxes." So you
Right.
can start with those things. Maybe not a specialty, but just how the person identifies. So those are two different approaches that you can take. And there are a lot of different um websites, and I call them like Google for therapists. So I mentioned Psychology Today earlier. Psychology Today is like uh, a search engine. So you can put in your zip code and you can start there. But then once you click enter, it will give you the option to put in your insurance, put in a specialty, put in uh, how the person identifies and spirituality and all of those things, and it will give you results based on the criteria that you put in. So you'll get a list of people who meet your criteria, and then you can kind of do process of elimination from there, or reach out to everyone and see who reaches out to you first.
Yes.
I
Yes.
always encourage people when they're looking for a therapist to cast a wide net and keep an open mind. So if a person must be in person, then I said, okay, well, that's going to greatly limit the number of therapists that you have access to. But if a
Yeah.
person is open to virtual, and here's some game, those of you who are looking for a therapist, you can, let's say you're located in Brooklyn, 112110, right? But you are open to virtual therapy, you're having difficulty finding someone in that zip code. You can put a zip code in Buffalo into Psychology Today and
Yeah.
find therapists, because as long as, and the laws are different from state to state, but for New York, as long as the therapist is licensed in New York, and as long as you are located geographically in the state of New York at the time of the session, you can see anyone who is licensed in New York. So you can Google some zip codes. Like, okay, I'll put in a zip code at Ithaca, and I'll put a zip code, Montauk, or whatever. You can find, as long as they're licensed in New York and you are
I
sitting
didn't
in New
know.
York when you have therapy, that opens up your options a lot, because they've called it a mental health crisis. So many people are seeking therapy, which is a good thing. So we
Yes.
have to be open to creative ways to get the help that we're seeking.
That is good stuff. I did not know that. So me myself, when I was in my search and I was looking, I'm trying to look local, and I'm like, wait, I'm not seeing what I want. And also when casting the net, you have networks, people, right? And people that know people. So when you put it out there, it's so funny. At my place of employment, a young lady came to me, working the same team, but she knows what I do. And she was like, hey, can you give me a list of, therapists or resources, right? And so word of mouth also works as well. So ask around, put it out there. I mean, that also may be a little jarring and nerve wracking, right? Because now a person might want to know, well, why are you looking for a therapist?
Exactly.
Girl, what you like? What you going through, right?
You can
But
talk to me. You don't need no therapist.
right, exactly. And so the reality is that you may get those questions and you don't have to answer them, or you could just say, hey, I just need the resource, right?
Right.
So, since we're on the point of resources and we're getting ready to bring the conversation in, do you have any additional resources besides? And I didn't hear you say ZocDoc, so just to let everybody know, no, not
No,
ZocDoc.
no, I didn't mention ZocDoc, but there's psychologytoday.com, and there is a tab on, probably on the left-hand side, that says find a therapist. You can click on that. No matter where you're located in the United States, you can find someone, based on your zip code. There's also, I call them affinity search sites. So you have like therapyforblackgirls.com, have
Yes.
therapyforblackmen.org. It's either .org or .net, I'm not sure. You have that therapyforlatinx.com. So there are a lot of different websites. You can also go to like Christian counseling um, accreditation sites, and they have directories of people who have their accreditation. There is ZocDoc. You can search ZocDoc. There's therapist.com, Monarch, I believe. There's so many avenues where you can find practitioners. There are also search engines. So they're directories, but they are directories of people who accept certain insurances.
Yeah.
So there's Grow Therapy. There is helloalma.com. There is
You have the Rolodex.
and you know what I'll do is I'll go back and in the comments, and I'll type that stuff up if people aren't writing it down.
Well,
But
we
these are
also
all
have them too. We're going to also
awesome.
share some
Perfect.
resources as well.
Mhm.
So definitely get in the comments, drop that for us because we want to know where to go. And so, what about your services and products? What is it that you do? Tell us more about your practice and how we can reach you if we want to talk to you.
Okay. Well, I launched my practice in October of last year. Things have moved very quickly, and I'm very grateful. I became licensed in September of 2023. My LLC and my Connecticut license was approved on the same day in October of 2023.
Wow.
I was credentialed to accept insurance in Connecticut and New York in December. And I
Yes.
saw my first client in private practice on the 13th of January. And
Wow.
within a month, my private practice was fully booked.
But
So
it's safe to say, though, you've been doing therapy as working for,
absolutely,
yeah,
yes,
for some time now.
yes.
Okay.
So I just
Which
started
is
my private
really,
practice, but
yeah.
I've been in the field since my first job. Even in undergrad, I was doing therapy in a correctional facility for my internship.
Wow.
So I've been doing it a while, but doing
Wow.
the private practice piece, that is very new, very different. I've worked in a variety of different settings, but I'm currently working in an inpatient psychiatric hospital, which is very different from working out of college, which is what I was doing before.
That is
Um,
a
so,
lot.
so that's a little bit what I do professionally. I also have the private practice. I see adults in my private practice, adults, couples, families. And as far as my products, I am an author. I mentioned that I wrote a book. I wrote my first book in December of 2021 called Your 21 Day Reset. And basically the focus of the book is adjusting your cognitions, the way you think, so that you can be better equipped to accomplish your goals. And I really wrote the book because so many people talk about resolutions at the beginning of the year. And I'm like, but it's the same resolution every year. You trying to lose the same 20 pounds every year. So maybe we are going back to the same resolution because our mindset needs a shift. So that's the purpose of
Yes.
the book. It's broken down into 3 sections. The first week is about changing your cognitions. The second week is about writing down, putting pen to paper and writing down your goals and how you need to accomplish them. And the third section is about identifying resources. So that is my book, and my book is available at drtayonline.com. And if you are looking for a therapist, you can reach me at Rafa Mind and Body. That's the Instagram. You can also email me at drtay, DRTE, at rafamindandbody.com. I am fully booked right now. Praise be to God. But I
Why?
am very
What's
open
so busy?
to referring folks because people, even if they just want to talk, they're looking for therapists, and I have no problem making referrals. If you're in another state and I'm not licensed in your state, I will help you, give you those resources, that some of the resources that I just mentioned, so that you can get connected. So I'm absolutely available for that as well.
Thank you so much for being with us tonight. And I'm looking forward to more conversations with you, just to talk more about this, because I think that it's just so vital that we continue to advocate and encourage people to take care of themselves, mind, body,
Absolutely.
soul, and spirit, right? To take
Absolutely.
care of the whole. I believe in the holistic approach to the human experience, not just focusing on one area, but the whole, the total man. So I would love to hear your closing remarks. If you have any last closing encouraging words or any statements to leave with us tonight.
Take the first step. Take the first step. If you are looking for a therapist and you don't know where to start, you have 2 people you're listening to right now who can point you in the right direction. I always tell people that taking that first leap of faith is going to be the first step in the rest of your journey. If you want your journey to go in a certain direction, you need to take that step and get the help. And if you don't know where to start, talk to someone who might be able to point you in the right direction, because it can be healing.
Yes, thank you so much for coming on with us tonight, and continue to keep doing the great work you do. We appreciate you, and we look forward to connecting with you soon. Have an outstanding evening. And again, everyone listening, everybody watching, please go follow her, reach out to her. And yes, we look forward to connecting with you soon.
Thank you so much for
Thank
having
you.
me. Bye, everyone.
All right. I am so excited about tonight, but I'm excited about the rest of the week. So if you tuned in tonight, please share the news that every day this week at 7 p.m. On the Matters of the Mind, we will be having a different topic every night. And so tomorrow night, we are going to be talking about, let me get the uh tomorrow night. This conversation to me is important. It's vital, especially in the faith-based community. So tomorrow we're going to be talking about I don't need therapy, I have God. How does spirituality intertwine with mental health well-being, offering an alternative path to healing and self-discovery? I can't wait to introduce my 2 guests to you tomorrow night. So if you are following me, please do so. Follow me on social media at Facebook, Elisa Abernathy Boston, on Instagram, Elisa Abernathy underscore Boston underscore. Follow me on all of these pages. Check me out. Share with someone. Encourage someone to join every night this week at 7 p.m. We will be having different conversations, and join us tomorrow. Thank you so much. Have a good night.